In the fast-moving world of news, it's easy to miss the meaning between the lines. That's where we come in. Each episode, we take real headlines from Newsline Philippines and let AI break them down. Not just the what, but the why it matters.
Okay, this is the deep dive. And today we're getting into a really specific report. It's out of Davao City in the Philippines.
Right, and we're basing this on an article from Newsline Philippines.
Exactly.
So our mission basically for this deep dive is to really unpack that source. We want to understand the key findings, what it's telling us about the health situation right there on the ground.
Yeah, definitely. And you sent this one over because it highlights something very particular. A confirmed link they found in patients at the Southern Philippines Medical Center, SPMC.
Right.
Specifically, people testing positive for both HIV and Mpox. So, okay, let's unpack this.
Well, what jumps out right away from this Newsline piece is the clear statement from the hospital chief. That's Dr. Ricardo Audan.
Okay.
The article actually quotes him confirming a very specific observation they've made inside the hospital.
And that observation, it sounds pretty striking. According to the source, Dr. Audan said that out of a recent group, just 11 HIV-positive patients admitted there.
Yeah, small group.
A significant number of those also tested positive for Mpox.
And that number is 7. 7 out of those 11 HIV-positive patients.
Yeah.
They were co-infected with Mpox. Seeing that specific statistic, in such a targeted group of patients, that's what makes this report really stand out.
7 out of 11. Wow. Okay, that definitely focuses the picture on what that specific hospital is seeing right now. Does the article give any more context about this group?
It does, yeah, a little bit. The report notes that most of these co-infected patients, they're male.
Okay.
It's just another detail. But it adds a layer to the specific pattern they seem to be observing there at SPMC.
So, okay, there's the bigger picture of Mpox globally, but this report really zooms in on this specific co-occurrence happening within their HIV patient population. It kind of makes you wonder why this link is showing up so clearly there.
Precisely. And, well, the source doesn't really dive into a deep clinical explanation or anything. But the fact that the hospital chief is highlighting this specific co-infection rate within this group, it suggests it's a significant focus for them. Maybe a concern.
Could be targeted surveillance, maybe? Or vulnerabilities?
Could be.
Yeah.
The report doesn't quite pin that down, but it flags the issue.
Okay. And beyond just the numbers, the article also mentions what Dr. Audan are telling the public about it all.
Yes, it touches on the public health messaging side. Dr. Audan gave some reassurance.
Okay.
He stated there wasn't really a need for panic, no mandatory measures like lockdowns based on these cases.
Right.
And he also clarified the masks situation, saying face masks aren't strictly necessary just for Mpox prevention since it's not airborne.
Okay.
Though he still advised using them in crowded places, just as a general health measure, which makes sense.
Yeah, general precaution. Sounds like they're trying to walk that line, report the findings, but also keep the public calm.
Seems that way.
And the report also mentions the hospital's preparedness, doesn't it?
That's in there too, yes. It notes SPMC has dedicated staff, medication, and a specific 9-bed isolation room ready for Mpox patients. It's equipped with negative pressure.
Okay, so they feel prepared.
Yeah, it suggests they're geared up to manage these cases right there in the hospital.
The article also, I think, quickly lists the common Mpox symptoms: rash, fever, headache.
Muscle pain, yeah, swollen lymph nodes.
And how the rash develops. Just sort of a quick reference point within the main story about the co-infections.
Right, just providing that basic info for context. But really, pulling it all together, the absolute core insight from this specific source, this Newsline report, is that confirmed statistic from Dr. Audan. 7 out of 11 recent HIV-positive admissions at SPMC in Davao also had Mpox.
So this deep dive, it really shows you that granular level of reporting, doesn't it? What's happening locally.
Yeah.
Capturing specific numbers, specific observations within just one facility. It's a real snapshot of a particular situation.
And if we try to connect this to the bigger picture, this report, it kind of raises an important question for you, the listener, to think about.
Okay.
How do these really specific, localized health updates like this one, detailing co-infections in a very particular patient group, how they feed into our broader understanding, our tracking of infectious disease patterns, globally?
That's a great point. And that's our deep dive into this report from Davao City for today.